Good afternoon, everyone. Welcome in. As you come in, you are welcome to introduce yourself in the chat. We would love to learn who we have here with us today. Hello, everyone. Just going to give everyone a few moments to come in. As you come in again, you're welcome to introduce yourself in the chat. We'd love to learn who is with us here today so we can connect with you. Okay, I am going to go ahead and get started. So, good afternoon, everyone. Welcome in. For those familiar faces with us here today, hello again. For the new faces, welcome. We are so happy to connect with you during today's Lunch and Learn event featuring our incredible partner from Engage with Skills Training. Before we get started, I'd love to introduce myself and cover just a few housekeeping items. My name is Kendall Lee. I am the Program Administrator of the Maryland Emergency Preparedness Network. The EPN is an emergency preparedness communication network operated by the Maryland National Capital Home Care Association, otherwise known as MNCA, in partnership with the Maryland Office of Preparedness and Response, that we refer to as OPNR. We provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I'd like to extend my gratitude to Executive Director Caitlin Hauk of MNCA, who's with us on the call today, and the dedicated staff at OPNR for their continued support, especially today on State Employee Recognition Day. Your partnership makes our meaningful work here possible, and so we thank you. Today, I have the great joy and privilege of sharing this space today with my remarkable colleague whose passion to carry out the mission-driven work of Engage With is truly awe-inspiring. I'm trying to contain my excitement because I'm so incredibly excited to turn this mic over to our incredible guest and begin this session. But before I do, let's just cover a few housekeeping items. For the recording, today's event will be recorded. You can look forward to receiving a copy of the recording following today's event. It will also be made available on our website as well as our YouTube channel. As for the audio portion of today's event, we invite you to unmute and engage with us, as this event is truly designed to be conversational. As for your camera, though it's not required, we'd love to see your faces during the presentation, so we invite you to turn on your cameras. As for the Q&A, we welcome and encourage comments throughout the presentation, again, as it's meant to be conversational. So please submit any questions or comments you may have into the chat box, which will be closely monitored by yours truly and our speaker, Amanda. So without further ado, I'm so excited to introduce you to Amanda Kreischer, Senior Director of Engage with Skills Training Program. Amanda, I'm turning over the metaphorical mic to you to introduce yourself and share with us more about this innovative training model that is Engage With.
Thank you so much, Kendall and Caitlin. I really appreciate the opportunity to be here with you all this afternoon over the lunchtime. Because it's lunchtime, please do not hesitate to eat your lunch if you need to. I know we're always really busy and just kind of trying to fit everything in. So I will not be offended if you're staying off camera so you can eat your lunch and you're just able to listen. As Kendall said, my name is Amanda Kreischer, and I'll just give you a little bit of background about me before we get started with an opening question. I am the Senior Director for the Engage with Skills Training Programs, which is an initiative of the Mental Health Association of Maryland. So right here, I always like to kind of pause and find out how many of you in the room have heard about the Mental Health Association of Maryland. And if you had, throw me like a little reaction emoji or something. I don't care what it is, but just curious. Anybody in the room familiar with who MHAMD sometimes is what you might hear us referred to as, but anyone familiar with that organization? I don't see any reaction. So that tells me that you might not be. So I'm going to give you a little bit of a deeper dive on sort of our parent organization before we talk about our program. So the Mental Health Association of Maryland is one of the oldest state mental health associations in the United States. So there's Mental Health America, which is kind of the national version, and then every state has their own version. So our organization was founded in 1915, and we are really bringing together everyone around mental health and mental concerns. So we are have programs that are focused on consumers. We have professional programs. We have advocacy, volunteers. So we're really kind of wrapping everything around the needs of people who are living with mental health concerns. So we have lots and lots of different programs, and my program, Engage With, is simply one of the offerings that we have. And as we come towards the end, I'll make sure that you have not only our website, but also MHAMD's website as well. So, I am a licensed social worker by background in education. My diploma hangs out behind me here. And I graduated from the University of Maryland School of Social Work in Baltimore and have been in the field for over 15 years. Most of my experience before coming to the Mental Health Association was working out in the community with older adults. So I spent 3 years as a social worker for a home hospice organization. And then I started the social work program in a community health and wellness program in Harford County at Upper Chesapeake. And that program is really supporting people who are living with chronic health conditions and trying to make sure that they had all the resources they needed in order to live healthy and successful lives and hopefully not come back to the emergency room a lot. So I bring all of that knowledge with me to our Engage with Skills training programs. And before I tell you really anything more about our program, I'm going to ask Kendall to pull up our whiteboard here for us because I want to get a sense from you all. What comes to mind when you hear the term engage with? What are the things that you think of? Maybe different words, maybe different thoughts, quotes, whatever. What kind of comes to mind when you think about engaging with? Excellent. I see lots of you typing in some comments. This is the fun thing about the whiteboard is you get to like kind of play around. You can add you can kind of click. There's a little T icon on the left-hand side. If you're not familiar with these whiteboards, click on that T and it'll get you into a text box. You can kind of make a box and then just type in some responses. If you are feeling a little overwhelmed by the whiteboard, totally okay. You can also type those into the chat or feel free to turn your microphone on and just shout them out for us. But like what comes to mind when we think of engage with? And this is a preview for you because I am the kind of presenter who is not going to let you just completely sit here and listen to me. I will ask you some questions as we go along. All right. So I'm seeing things like empathy, connection, working with a person. Yes, absolutely. Kind of making requests. We're kind of doing this team player kind of situation. Excellent. All right. Any other thoughts? Anything else kind of come to mind? Listening. Yeah, absolutely. Exchanging. Good. I like it. Here we go. Now we're really moving here. Presence. Yes. Love this. Awesome. All right, I'm going to give you, I forgot that we could put throw a little timer on here, but I'll just give you another few seconds to kind of put your thoughts out here. Sharing.
Mm,
Love it. Keeping an eye on the chat in case anybody's dropping anything in there. Participants. Yeah. Education. Love it. It's really fun to like see all the little like like everyone's got like a little like name that's like just floating around the screen. That's really fun. I'm like, ooh, everyone, what do we got now? What's coming up next?
I love it.
All right. Awesome. Okay. Well, half of my job is done. So that's great. Um, because really, when we think about engage with as our program, we are really talking about how do we effectively connect with the people that we're working with? How do we bring that empathy? How do we bring respect? How do we bring communication and listening skills and all of those things into our conversations and into our interactions so that we can have a really positive connection with that person? Because really, like at the end of the day, what this is all about is how do we people, right? How do we have good relationships with people? And so that's what our program really does. So engage with skills training programs, we've been around since 2017. We actually started initially as an in-person training with the plan to convert to a live virtual training even before COVID. We were actually in process of that so that we could scale it and we could make this something that was really easily accessible to everyone. Um, so I'm going to have Kendall close out our whiteboard here. But if you have any other thoughts or any other things you want to share, please feel free to do that into the chat. And then I'm going to switch over and I'll share my screen so we can kind of go through some presentation slides. And I'm going to ask for a little bit of grace here. I have two screens. My camera is on this screen and my presentation is over here on this screen. So if I occasionally look like I'm looking away from you, it's only because I'm looking at the screen over here. So, all right. So there we go. Let's get the presentation started. So we are really focused on this idea of bringing not only this human touch in our teaching and our education. But we do this in like a really cool and kind of fun platform, which I'm going to show you and teach you a little bit about here in a few minutes. But our training is taught all live by a certified instructor who has an extensive background in mental health. And then we take that awesome instructor and all of their knowledge and we put you in this really cool gaming platform where you have an opportunity to interact not only with the instructor, but also with each other. And so our mission really is to make sure that our caregivers have the skills that they need to provide compassionate and effective care for the older adults that we're working with. So, right now, we have a partnership with the Department of Aging to offer our skills training at no cost to those who are supporting older adults aging in the community. And we have a full spectrum of what that looks like. So, traditional groups like home care, hospice, adult day services, assisted living, all the way down to more of our community-based programs. So our 211 operators, we are connecting with some of our emergency management participants. We're looking at having conversations with library personnel and just really trying to make sure that any person who's interacting with an older adult in the community has the skills that they need to do that in an effective way. All right, so I've kind of given you a little bit of this background here, but you're going to see on the screen here, we have these sort of three really key values and points that all of our trainings are going to focus on. So everything that we teach and everything that we do to prepare people to use these skills comes from the lens of empathy, respect, and effective communication. And so sometimes people refer to these as those soft skills. Not my favorite term, but it is one that most people know. But really, it's not so much soft skills, it's just people skills, right? So it's giving ourselves the necessary tools to be able to interact in a kind, compassionate, and empathetic way. So I'm going to do a really quick video. This is your first little take a look, kind of behind the scenes of what our virtual training environment looks like. So I'm going to play this video. I'm going to kind of talk over it as we go to kind of give you a sense of what you're seeing. And then just as a reminder too, like if at any point you're like, Amanda, wait a minute, I'm lost, or can you go back and say that again, or I have a question, please do not hesitate to like turn your microphone off or turn it on and shout that out or put it in the chat. Okay, so our virtual training environment. Quick little video here to kind of show us what this is going to look like. A little like intro here with our fun little guy. Okay, so big environment. So this is not a place where you're just going to kind of like come in and you're going to sit in one place and that's the only place that you're going to learn. Our skills training is extremely interactive. So it is, get in there and you're going to talk to other people, you're going to talk to the instructor, you're going to engage in activities. So as we come into the kind of lobby area of our training center, you'll see, different people in there kind of ready to participate. In our dining room space, you'll see there's a TV on the wall. During some of our trainings, we will watch short video clips and have some discussion. So we bring people into there, get to sit situated and kind of watch the video and then have discussions. One of my favorite things about the training center is it's always a bright, beautiful, wonderful sunny day, perfect weather here in our virtual training center. So you can see the participants at the table. We focus everyone on the screen when we are ready to show those videos. Across the hall from our lobby, we have our kind of auditorium or classroom. So the main portion of the training is going to take place in here. You'll see it looks pretty common to most classrooms, and there's many places that people can sit down. There's an instructor at the podium. You have access to the PowerPoint presentation. So lots of different kind of things happening in there. Backyard is my daughter's favorite area. She's 4. She loves when my avatar goes for a little swim in the pond because you can kind of walk in there and then jump out. She thinks it's the greatest thing ever. So you can do that while you're waiting for your training to start. And then we're going to come in through our small group room here. So in part 2 of our training and some other ones, we come in here and have some small group discussions. And then in our visiting area or kind of our day area, we have on the wall, you'll see a screen with 4 adults. That's our demonstrating respect game. And that's one of the activities that we do to really give people a chance to practice what we've been talking about and what we've been learning. So a really fun kind of way to do that. All right. So now there we go. So we kind of gave you a little bit of background on sort of who we're working with through this grant opportunity with the Department of Aging. But really, again, it's kind of the full spectrum. So anyone who is supporting an older adult aging in the community is really who we're trying to target. Every person who attends the training is going to get a couple different things from it. So first of all, unlike a lot of other virtual trainings, our trainings are taught by a live instructor. So they are not recorded. There is no kind of like watch a video, answer some questions, check your box and move on. And no session is the same because every session is going to have different students. We're going to have different discussions. So we have that live instructor there. That means that our sessions are offered at certain times of the day. However, we do try to make sure that those are times that are easily accessible for our participants. And excuse me, our sessions are offered multiple times during the day and the week. So hopefully there's some that kind of fit into a person's schedule. When they've completed any of the courses, they're going to receive a certificate of completion and a training summary and reference guide. So that means that no one needs to kind of frantically be taking notes as they're going through the training. They really can just sort of sit and soak it all in and participate in the activities because we're going to send them all the things that they need after the training is over so that they can have that to kind of go back to. We also have an opportunity to offer continuing education credits. So our social workers, our licensed professional counselors and therapists, and our CHWs all receive continuing education credits for their license or certificate renewal. And our CNAs and GNAs are also eligible to use the training as part of their I believe it's 20 hours of annual continuing education training that they need. So that is also available to all of our participants. So now I'm going to kind of get us into a little bit more of the meat. But before I do that, does anyone have any questions or comments, concerns, anything coming up yet? Okay. Great. All right. So I'm going to walk you through all of the different training sessions that we have. And so we're going to start here with our core skills, which is our foundation class, kind of what everyone needs to know. And during this class, we are going to prepare participants to put 8 new tools into their toolkits. So we're going to talk about exhibiting respect. We're going to talk about overcoming ageism. We're going to spend a lot of time talking about communication skills. So like we pulled up on the whiteboard, that listening, our nonverbal communications, the words and the way that we say them that come out of our mouth and our verbal expression. Skill 6 is probably one of my favorites because it is an opportunity for us to bring it all together and do sort of a choose your own adventure. So we introduce everyone to this older adult who is living with Alzheimer's dementia and has some pretty common concerns. Not bathing very regularly, not eating very much, not really taking their medication. And we get people to kind of think about, okay, now that we've learned all of these different things and we're kind of coming at this with hopefully a different perspective, how are we best going to interact with this person to show them respect, to be empathetic, and to do something that we call preserve their ego. So that, in kind of a nutshell, is this concept that we all have a way that we see ourselves, and we don't necessarily need to force someone to see something about themselves if it's not going to be helpful in that moment. So we go through this exercise and we kind of talk through like what would happen if we did this, what would happen if we did that. Okay, let's say we did this. Now we're going to kind of try some other ideas and really get a chance to practice what we're teaching right then and there in a safe environment. We end that training session by talking about suicide risk factors and de-escalation. So, for fun, I want to show you a tiny little bit of our demonstrating respect game. So hopefully it's going to work for me and not do anything weird. Very good. It didn't do anything weird. So that's great. And I want to kind of, this is going to be one of those times where I'm going to actually ask you to turn your microphones on because we're gonna play this a little bit. So in our respect game, what we do here is we give people an option to kind of, again, create sort of who it is that they're going to interact as. So we have different genders, different race, whether they're wearing business casual or scrubs, do they have tattoos or not? And then we give them kind of a just standard name. And then we give them an opportunity to meet some people. And their goal in this game is to be respectful, to provide appropriate care, and meet their responsibilities. So we're going to meet Samir here. So he is 68 years old. He's a second generation American. He's pretty easygoing, but he is also very formal. And he worked in construction. So when we come in to visit him, we're going to have an opportunity to kind of see what's going to happen. And so I'm going to ask you all here to help me make the decisions. We'll go through just a couple of them just so you get a feel for kind of what this experience is like. So as you're approaching Samir, he's looking down at some documents and he doesn't notice you. So we can either make sure that he notices us before we approach, or we can approach him and say hello. So what are we going to do? Anyone? Thoughts? You'll notice that there's like the little circles, kind of what's going to happen if we do one thing or the other. Okay, I see a chat here. All right, so we're going to make sure that we're noticed. Perfect. Okay, so we're going to make sure, and so we say, "Hi, are you busy? Can I join you?" All right, and so Samir says, "Oh, well, hello. You caught me at a good time. I need a break from this paperwork. Come on over." Okay, so now you'll see our care went up, our responsibilities went up, our demonstrating respect went up. Great. So he sets the paperwork aside and he looks at you. So now we can either introduce ourselves and ask how he'd like to be addressed, or we can ask him about the paperwork. Now, for fun, I'm going to ask him about the paperwork and see what happens. So that's a lot of paperwork. Sometimes it can be confusing. Do you need any help? Okay, so probably feeling like they're doing some good right here. And Samir says, "Yes, thank you for asking, young man. It should be illegal to print important documents this small. Come on over and tell me if I'm reading this correctly." Okay, so again, good scores happening here. So we see some good things going on. So you step in to look at the paperwork and he notices your tattoos and he seems shocked. So are we going to address them or are we going to avoid the subject and focus on the paperwork? Any thoughts? I'm going to say we're going to avoid the subject. Let's see what happens. So looks like some legal paperwork. Mr. Patel, are you doing it yourself? I think I can manage this just fine on my own. Thank you very much. All right. Care didn't go well. Responsibilities didn't go well. I didn't do a good job of demonstrating respect. So now he's gotten very stiff and formal. He's feeling a little uncomfortable. So we can either, again, explain those tattoos or we could defend them. Now, it's a pretty common reaction for most people to say, well, I'm going to defend my tattoos. You shouldn't judge me just based on my looks. I've got my own story and my own problems. So Mr. Patel says, I'm sure you do. I'll solve my problems and you solve yours. How about that? Okay. Not great. Not great. So here, now he's kind of put the paperwork aside and it's clear that he wants you to leave. So again, you can kind of see how these interactions really change based on the way that we are choosing to interact. So each of the characters has their own kind of situation that you're trying to navigate through. And I always tell people after the training, they do get a link to this game so they can go back in, they can play it again, have an opportunity to try different avatars. Does the person react to you differently if you're in scrubs or business casual, if you have tattoos or not, if you look like them? There's really a lot of interesting ways to kind of use this to really solidify and continue to reinforce that learning. Our next session that we offer is our responding to mental health issues. And this one really is going to dive deeper into some of those common mental health concerns. So we talk about depression, anxiety, bipolar disorder, and schizophrenia. And our first skill here is thinking about how do we redefine perspectives about mental health? And that's not our perspective or the other person's perspective, but that's really about how do we effectively communicate for a person who maybe has a negative perspective about mental health. So if we think about our older adults, many of them grew up in a time where mental health wasn't talked about. Treatment for mental health was quite frightening and scary, and you just kind of swept it under the rug. And so really what we're doing here is thinking about, okay, how can we use the information that the person is willing to share with us in order to engage with them and support them and help them get the resources that they need. We do an activity here where we talk about some myths and facts around suicide with older adults. This is really fun. A little question comes up, and then as people are answering, their little avatar jumps from one side of the room to the other, so you can kind of see what people are thinking. And that leads us into our discussion about intervening to reduce suicide risk. We talk about how to deal effectively with anxiety and then promoting trauma-informed interaction. So we're not teaching trauma-informed care, but we're really focusing on what are the things that we can do to make sure that we're being trauma informed as we're engaging with people. Next up, we have our understanding substance use and medication misuse. And this one we recently started offering and has been quite a popular session. I know there's some new kind of regulations around knowledge and understanding of substance use. And so here we're really going to get people to build those skills around what are signs of substance use. How is a drug going to impact the person? So you'll see on the screen this picture where we ask people to say, to kind of choose, like, here is here's a drug, and then here's how it's going to impact that person, and try to match them up together. And this is really fun because it can be a little intimidating, and we always tell people like it doesn't matter if you get it right or wrong. We really just want to start to think about like, what does this look like? And then we'll talk about what the correct pairings are, but really giving people an opportunity to think like, okay, maybe this is this. What typically happens is most people kind of switch up the reaction for alcohol and benzodiazepines with heroin and opiates. That's typically like the one that kind of gets a little flopped. So it's a great learning opportunity. And then the rest of the session is really about how do we communicate our concerns about the person's use. And while we're doing that, how do we help them make an informed decision about any changes that they want to make or any goals that they might want to have around their use? So again, we're really coming from that perspective of preserving that person's ego, not forcing them to see or do something differently just because we think they should, but really kind of continuing with that autonomy. In our navigating dementia and traumatic brain injury, this is also another favorite. We're going to really focus on what are some of those early signs of dementia. We know that a person does not go from full cognition to completely impaired. There's all these little steps along the way. And so we actually, in this activity, what we do is we say, okay, here is a pretty severe symptom of dementia. And as a small group, we want you to figure out like what are the little things that would maybe lead up to that. And so it could be, if they're having difficulty just kind of like remembering people. It might be that they stop using names when they talk to someone, or that they're not able to identify someone in a picture. So, like, there's these little things that kind of happen along the way. And when we are more prepared to see those, we can use that information to better support them. In this one, we also talk about the difference between delirium and dementia, which is a really important concept for people to understand since we know delirium is a medical emergency. And then we do an activity where we introduce people to the lady on the screen. Her name is Kathy and her caregiver. And we watch two videos of some interactions. And we talk about like what worked and what didn't in each of those videos. And kind of giving people, again, sort of that opportunity to really practice right then and there and say, oh, okay, I can see why this didn't work or why this did work. And then finally, we end this session by talking about how do we minimize the impact of those small changes along the way? And then how do we communicate to this person with understanding and support them in the decisions that they're making? And then we have our partnering in care supplement, well, probably one of my favorites, because this one is all about that person centered care and really tying all of our kind of key values together into one session. So here we talk about this concept of creating partnerships. What are the things that we want in a partner? So a lot of our training, when we think about training for empathy, that's not always an easy thing to teach people. And so the way that we do it is really getting people to use themselves and their own experiences. So we get people to think about like, if you needed a partner in care, what are some of the values or skills or traits that you would want that person to have? And then when we kind of are feeling like, okay, I understand that for myself, we can say, okay, now let's think about what are the things that an older adult might want in a partner? What are some of those same traits, values, skills? And you probably guessed that, like most of the time, that is going to be almost identical to what the person said. And so that really gets people to kind of understand empathy from a different perspective. And this one, we also talk about the concept of core needs. So, if you're familiar with Maslow's hierarchy of needs, where we have kind of those basic ones at the bottom, and as we go up his pyramid, things get a little more sophisticated. And so here we kind of thought, like, think about again ourselves, and we say, okay, let's imagine that you're in this situation, and a couple of your core needs aren't being met. How challenging would that situation be for you? And we have people kind of rate it on a scale of 1 to 5. Then we change it up a little bit more, and now we take away some more of those core needs, and then we have them rated again. And what happens is that second one, which has less core needs available and more of them taken away, their scores are higher. And so again, here we think about, okay, so if this is how you would react in this situation, now let's put it in perspective for an older adult. They've been forced to move in with their family, or there's all these different pieces, and now there's new rules and restrictions, and everything happens at certain times, and that doesn't feel good. And so just like that would be really stressful for you, we can imagine how challenging that would be for the older adult. We again sort of do a pull it all together, choose your own adventure, engage in a meaningful way. And this one we do a little bit more from the perspective of end of life. So we meet Mr. Chen here and kind of talk through some of the challenges that he's having after being given a terminal diagnosis. And then my favorite part of this one is spending time with the participants and getting them to think about their own self-care. So the work we do, we know is hard. And we have to take care of ourselves in order to be able to support those that we're supporting. So we walk everyone through an activity where they create their own self-care plan. And when they finish this session, they actually get a PDF copy of that. So they're able to have that, make changes to it, adjust it, and really kind of utilize that. And then our course that we just started offering is our managing aggression. And so here we're really going to be focusing on what are those skills that we can use to de-escalate an agitated or aggressive person. And so that includes things like our communication skills. So whether it's our verbal communication or our nonverbal communication, knowing what a person's safety zone is. So like how close can you get to this person before they start to feel uncomfortable? And for this one, we do an activity where we actually bring all the avatars out to the parking lot and we line them up in pairs, kind of facing each other. And each pair has an opportunity to kind of approach each other in different ways and in different environments. And we ask people to kind of hold their hand up or sort of stop the other person's avatar when they've gotten into that kind of now you're in my zone. And it's really cool to see an overhead view after everyone's done it, where like it's not a straight line. Like some people have the avatar really close, some people have it farther away. I've had people say to me, if they're paired with somebody from their own organization, they're more willing to let that avatar get closer to them. But if it's somebody completely new to them, then there's more of a distance. So again, building that empathy. And then our final skill here is talking about how do we intervene effectively, pulling again all of these skills together, that empathy, that respect, and that effective communication. Okay. So that's a lot about our kind of our different programs. Before I go over a little bit of the evidence, just wanted to check in and see if anybody has any questions, comments, concerns, anything coming up yet. You're all happily eating your lunches and just listening. Okay, don't hesitate to throw those out if anything comes up. So our training has been kind of gone through a couple different independent evaluations where we were really looking at how does this training impact not only the employees themselves, but the older adults that we're working with. So we've done 3 independent evaluations, and our first one really looked at staff turnover. So this was done with multiple nursing homes in the Maryland area. And what we found after the training was that the average reduction in turnover for staff members was about 40%. So really what that kind of taught us is that when the staff members felt prepared to manage some of the challenging situations, they were, they felt empowered and they were able to kind of get through the challenges of their day. And I'll kind of backpedal here just a little bit. In those trainings, we were not just focused on the caregivers. So we trained the CNAs and the GNAs and the nurses, and we also trained the activity staff and the facilities maintenance and the housekeeping and the dining, because every single one of those people had an interaction with the older adult. And sometimes it's the staff member who maybe we wouldn't expect to be the closest to that person, the one who really builds that connection. In our second study, we looked at customer service skills of the staff members. So all of the staff members, again, training everyone in the building, were rated by their supervisors on their customer service skills. The score was 0 to 5. So they did that before the training and then a couple months after the training. And what we found was a 17% increase in scores, which equaled just shy of 1 full point. So really exciting to see that, again, when we have these tools, when we have these skills, people are better able to interact with other people. And then our last study that we did, here we looked at PRN medication use. So we were looking at the use of as needed pain medication and antipsychotics in the assisted living and the skilled nursing side of this particular building. And we found a statistically significant decrease in the use of those as needed medications. We also spent some time talking to the residents in that building and asked them, how have things changed after the staff have gone through this training? And what they told our evaluators was that they felt better respected, better listened to, and better cared for. And I don't have it on the slide here, but kind of a fun extra piece of information, kind of going back to the staff reduction side of things, is that that particular group, I had the privilege of presenting at a national conference with their administrator. And as we were preparing for the conference was last November. So they did their training in June of 2022. And as we were preparing in October of 2023, she went back to her data and discovered that 76% of her staff members who had taken the training in June of 2022 were still there in October of 2023. And they actually had achieved their lowest vacancy rate in the whole time that they'd ever been opened. And she really attributed that to the staff feeling better empowered and having those skills to support the work that they were doing. So it's exciting to see kind of how things sort of move as people feel like they're tucking those skills into their toolkits. All right. So that's kind of the last piece of kind of who we are and what we do. So again, our training right now with the support of the Department of Aging is being offered at no cost to any organization that is supporting older adults aging in the community. So this, if you scan this QR code, it'll take you right to the registration page. You are more than welcome to sign up for whatever classes fit your schedule best. We often will tell people the only sort of caveat to registration is our core skills class. That first one that we talked about is taught in 2 sessions. So we have a part 1 and a part 2. Highly recommend and encourage everyone to take that part 1 before they take that part 2. Obviously, if something happens and a person shows up for part 2 and they haven't been to part 1, we're not going to tell them they can't be there. We know that scheduling and kind of shifting things around where we want to be respectful of that. We'll just help get them scheduled for a part 1 session. because the sessions are open to any organization, you can, have one person from your team register for a session. You can have 10. It really is very flexible. And this program with the department is running through September of this year. So limited time offer to be able to participate in the training. Okay. All right. So any questions, comments, concerns, thoughts, feelings? Helpful, not helpful? Yes, Amanda, I can't wait to participate. I already have staff doing it. Tell me where we are.
Can you say a little bit more about the continuing education credits that are available? How many, and does it do they get credits for each unit that they complete, or is it a package deal? They do the whole thing and then get their CEUs?
Yep, great question. So for our licensed social workers and counselors and therapists, we offer for the core skills, it is 3.75 hours of continuing education. And then for any of the other classes, it is 1.75. So it is a total of up to 12 and a quarter, I think, if I'm mathing correctly, that they can have. There is on the registration page a little checkbox if someone is interested in receiving either the social work credits or the credits for the licensed professional counselors. They check that box, and then they'll receive a secondary certificate that has the information about the approval organizations for those. So social work, we're approved through the Association of Social Work Boards, their approved continuing education program, or ACE program. That's a national. And then for the licensed professional counselors, we're approved by the Maryland Board of Professional Counselors and Therapists. So that for those LCPCs and therapists, that is specific to Maryland. Great question.
Do you know off the top of your head, or maybe it's on the certificate, are these considered, these are live?
They are considered category 1.
Okay.
Yep.
All right.
Yes. I know, right? Because I'm always like, okay, how do I get my category 1s? I actually got in trouble last year where I'd had a lot of category 2s and I had to find some category 1s to get me.
I've
So
been
yes.
there too. So
yep, they are considered a category 1 because it is a live session. So yes, you get your category 1s.
Okay, great. Thanks a lot.
Yeah, absolutely. Great question. Any other questions?
Diane said something very lovely in the chat. I can read it off. She says, Kendall and Amanda, very informative information. I do not work in a healthcare setting, but I'm very interested in this training. Maybe I can talk with Amanda about this. Thank you. Thanks, Diane, for being here.
Yeah.
She is our friend and partner from Maryland Project First Line, which is an initiative run through CDC, Project First Line. So thanks for being here, Diane.
Thank you very much. It truly was informative. I was a couple minutes late, so I didn't hear some things in the beginning, but hopefully, just if you have any time in the future,
yes.
Just because we go into a lot of healthcare facilities to do the training, and it would be, I think, helpful
Yes.
to have some of those skills.
Diane, are you working with older adults in the community?
No, not directly. No.
But you're supporting organizations that do?
Yes. Yes.
I mean, I have a lot of wiggle room from the Department of Aging. So
okay. Actually, we did a training at the Department of Aging in Anne Arundel.
Nice.
So
great.
Anyway, maybe at some point we can just
yes, Diane, let's connect because I think I can find a way to get you in.
Okay. Thank you.
Yeah, absolutely. Absolutely. Any other questions? All right. Well, I'm not one to just kind of like have you hang out just because it's scheduled until a certain period of time. So if there's no other questions, I know Kendall has just kind of a couple little housekeeping things to end us here. She just included all of both of our contact information. So you can reach me at the email address that is there. And again, too, we also have information about the program on our website. We also have a page that is specific to this program. So you have that information as well. It's just engagewith.org/MDOA. And then if you are interested in registering and you did not get a chance to scan that QR code, I will also just throw that registration link in there again as well, so that you can connect with us that way. Yes.
Thanks, Christopher. Christopher said very good information. Thanks for being here and thanks for participating. Okay. I am going to wrap things up for today. So as we conclude today's webinar, I want to extend our heartfelt thank you to our incredible guest, Amanda, and to each and every one of you, our attendees, to contributing to the conversation thoughtfully, which made for an engaging session. The discussions we've had today, I believe, highlight the importance of continuous learning and how no-cost, evidence-based training is such an invaluable investment in enhancing our caregiving skills, and or, as Amanda called it, our people skills that allows us to better serve those we care for. Please look forward to receiving the webinar